Hey guys, I hope you had a really good Thanksgiving. This podcast is really about trying to ascertain when counseling is necessary, and it depends on a lot of factors. The first is, are you in distress? So, certain disorders are very likely to cause internal distress, which we say as a psych term is ego dystonic, meaning that you hate the way you feel. OCD, anxiety, depression, people do not like that. They know something's wrong, they're not sure really what it is, but they don't like the way that they feel. And the therapy for those disorders is fairly effective because people don't want to feel that way. They want help. They want to feel better. They want to feel like they used to. And counseling is extremely successful with disorders like that. And with disorders like PTSD or specific phobias, like if you're afraid of a specific thing, that's probably actually the easiest way to help through counseling is specific phobias, because exposure therapy for OCD and PTSD and specific phobias is really well researched. It's fast, and it usually results in success. So those things are really easy to treat in therapy. Now, of course, there's some stigma about if you should go to counseling. Everybody always thinks, oh gosh, people that go to counseling are weird or crazy. And hopefully we've tried in recent years to reduce that stigma, because nobody that I see in my office is crazy at all. Actually, it's crazier if you are experiencing distress and you're not going to do anything about it. That's a lot more concerning to me. Because that's when people substitute other ways to try to make things better, like drugs, alcohol, food, eating disorders, any sort of addiction, instead of coming to counseling, which just prolongs the process. So I definitely think that counseling, most of the people that I see are completely normal and interesting and smart and awesome, but struggling with one specific thing, so, or multiple things, but they're not crazy. There are some disorders which are egosyntonic, meaning that you might not see that there's a problem, but the other people, and there might be some consequences of said problem. So certain disorders like bipolar disorder, especially if you're manic, feels pretty good, but there might be some consequences, like reckless behavior, impulsivity, spending money, and then there's an eventual crash. And other people also might not agree with your behavior. Same thing for schizophrenia, in that if you're paranoid, you wouldn't necessarily think that the problem is you. You might think the problem is other people. But again, there's consequences for said behavior, such as getting in trouble or seeming not logical, or getting arrested or things like that. So those are completely treatable for therapy too. It just might not be a self-referral. It might be coming from family or friends, but still equally treatable. It's just that there's not always an awareness of symptoms like there are with other disorders. Either way, though, counseling is really effective. Now, I know a lot of times people think medication is the answer, like medicate first, but I think it's important first to try to see if we could fight these mental health symptoms without it first. And then if medication is necessary, then absolutely we should go that route. But until you know what you have and until you've really explored it in depth, you might not need it, or you might think you need it and then realize maybe you don't. And so that's kind of the intro to counseling. There's all different forms and different types, and we can talk about that later. But research has shown that it does cause your brain to change. So it's really interesting that by just having someone to talk to who's listening, but also kind of challenging some of the thoughts you have or reframing things in a different way, brain studies have shown that your health improves. So I have research to back this, luckily, and it is really effective. And a lot of times it doesn't take years or 2 years or 5 years. It just takes, the effort to come every week. And most of the time, it could be 6 months, it could be 4 months. It depends on the client, but it is something that is an option for you. And if you're interested, give me a call and we can see if you meet the criteria. All right, guys, have a great day.